a UK drug policy and advocacy organization and registered charity where he's worked for more than 20 years. Steve has published a number of briefings, reports, journal papers, and books on drug policy reform in the UK and around the world. And he served as a consultant for a number of governments and UN agencies and as an advisor for the Global Commission on Drugs. Okay, that's all quite a mouthful, but I also just want to say that Steve and Shayla are dear friends. And I am wearing this t-shirt that no one can see. Okay, so that'll be our only view of it tonight. And this t-shirt is from Release, where Shayla works, where I had the chance to do a 2-week fellowship last year and learned a lot about drug policy reform and the possibilities of more humane futures in Singapore too, that I was very inspired to bring home. Okay, so before I I think the format we're going to use for today's session is I'm going to kind of be putting to Shayla and Steve some of the most common and dominant narratives about drugs in Singapore that the government is very aggressive about propagating, and then they'll kind of take them on, right, and respond from their perspectives. And so I want to just set a bit of context about Singapore's drug policy before we go into that segment, right? So Singapore has some of the harshest drug policies in the world. And not only that, it's also one of the most vocal advocates of harsh drug policies on the international stage. The government has been doubling down on drug policies and the death penalty when much of the world is moving towards progressive drug policy reform, because many governments are able to admit that the war on drugs has failed and prohibition is not working. In fact, it's cost millions of lives around the world, right? But in Singapore, the state is only getting more aggressive about doubling down on prohibition. In recent years, the government has also increased penalties for drug possession, including judicial caning. And in recent news reports, has even proudly claimed that they arrest and detain children as young as 11 years old for drug consumption. The Minister for Law and Home Affairs also recently gave a ministerial statement in Parliament defending the need to retain harsh drug policies. And I think a really important part of this narrative is that the government relies very strongly on this claim that an overwhelming majority of Singaporeans support Singapore's harsh drug policies and the mandatory death penalty as a reason for retaining them, right? And they publish regularly, these surveys that the Ministry of Home Affairs conducts to show that public support remains strong. But the value of public opinion is only as meaningful as the public is well educated on the issues. And so, but what we have in Singapore is a very uneven information ecosystem, where most people are not given the opportunity to encounter perspectives that are contrary to government propaganda, right? Because we're all raised on, a very particular, very strong narrative that starts from a young age when we're in school that just, reinforces and sells a lot of fear, stigma, and danger that's associated with drugs, with people who use drugs and people who sell drugs, to the point that they're really dehumanized. And so unless there are individuals who have a special interest in the topic and independently pursue knowledge on this topic, most people don't have easy access to other narratives because of media censorship and all the laws that restrict open discussion on these topics. There's also, of course, as we know, a very pervasive culture of fear around questioning the government's authority on these issues. And I think one very good example of this, censorship I just talked about is that TJC had put together very, I think, painstakingly and lovingly, like an exhibition on the death penalty and the anti-death penalty movement in Singapore that was supposed to run for these 11 days from the 10th to the 20th of October. But 1 week before we were due to open, the Media Development Authority, IMDA, told us that they won't be able to give us a license because Ministry of Home Affairs said that it was one-sided and undermines the national interest. So, spaces like these, having the opportunity to talk openly without censoring ourselves about drug policy is really precious. And so that's why I think it's also really important to me that today is a no holds barred discussion. So please feel free to ask any and all questions you have. Put your questions in the Q&A box that's at the bottom of the screen as we go along, and then we'll have a Q&A segment once we're kind of done with the first segment of sharing. Yeah, so because the government upholds this a lot of these murderous drug policies in our name, claiming that it is the public support that allows them to continue, and in fact requires them to continue using the death penalty, incarceration, surveillance, policing, and other forms of violence against people who use drugs. We then have a responsibility to educate ourselves on the consequences of the drug policies that the state retains in our name. We need to look at what the evidence shows, and with an open mind, consider the alternatives that are possible, what kind of society we want to live in and we want to build, before we can decide whether to lend our support to the government stance on drugs or whether we want to demand change, right? So I invite all of you to listen, learn, ask questions, and then ultimately decide what your verdict is. Okay, I think Steve and Shayla want to say a few words before we start, so go for it. Steve?
You want to start, Shayla?
I was hoping you'd be the first to start, Steve.
Okay. Well, the first thing is to say hello, everybody, and thank you, Kokila, for that introduction and for the opportunity to speak to you today. I don't think I've done a presentation to a Singapore audience before, so it's a great privilege, and it's an exciting opportunity for us. I think the first thing I wanted to say was that we're going to be speaking about our experience, or I'm going to be speaking about my experience, and Shayla similarly. Although we do operate, my organization Transform does operate internationally, I think it's important to acknowledge that we are based in the global north. I'm based in the UK, and my experiences reflect the political culture of a global north country, and so we're sharing our experiences to share the learnings that we've had making these arguments in different environments, and to show solidarity with the work that you're doing. But I just want to caveat it that it is a global north perspective, and I certainly don't want it to come across as patronizing or colonial. That's the last thing that we would want. Shayla.
Yeah, I mean, absolutely. So I'll say my working experience comes from the US, the UK, and China. And I wasn't really in the policy space in China. I was in the healthcare space, but working with LGBTQ people using drugs there. And like in each place, even working in different localities in the US, right? Like context is everything. And we're going to sort of, so the spoiler towards the end, but like when you're doing sort of bottom up, like sort of grassroots community work to change some of these things, like even the differences 40 minutes away working in two different cities in the States, like the cultural differences were so vast that like I could not import a lot of the things that I did in Washington, D.C. to what I was doing in Baltimore. And so I think everywhere, like the fact that neither of us have ever really worked in or been embedded in community in Singapore obviously means that like there will be things that are unknown to us, but also like hopefully like we're engaging in a mutual learning through the dialogue that we're going to have through the Q&A and bits of this. So just excited to be here, and thanks.
And I just to add that although I haven't worked in Singapore, I have interacted with Singapore, the state of Singapore, in various UN forums, both in Geneva at the Human Rights Forum, and in Vienna quite frequently at the Commission on Narcotic Drugs. And I just think it's important for people to realize in Singapore that your perception of how Singapore sits within the global community may be distorted by government propaganda or messaging, because increasingly, particularly around the issue of the death penalty, Singapore is increasingly a pariah state at the UN. The death penalty for drug offences is illegal under international law. It's a fact that is repeatedly stated to Singapore in UN forums by other member states and by UN entities. And their position on the death penalty is increasingly seen as bizarrely incongruous with the wider perception of Singapore as this kind of futuristic city state with a sort of that's an economic hub for much of the world. And yet they have this bizarre, barbaric, medieval policy on death penalty and drugs. And that incongruity, that sort of anomalous position they have on drugs is very evident in UN forums. And they are clearly aligning themselves with just some of the most worst oppressive human rights abusing countries in the world, like China and Russia and Iran and other countries that still execute people for drug offenses. So just to understand, this is not something that we are saying for the first time. The critique of Singapore's position is very vocal on the global stage, and it's not just activists, it's governments around the world and UN agencies who are making this critique.
Thank you. Okay, so we are going to jump into the different meta-narratives, or myths, I'd say sometimes, and the government propaganda on drugs and the different pieces of it, and then we'll tackle them one by one. Okay, so the first is that the government, Shayla and Steve, often claims in Singapore that drug decriminalization and legal regulation have failed and led to more harms in other parts of the world, right? So, our Minister for Law and Home Affairs, Shanmugam, often likes to talk about this failed experiment in Oregon and how, it's been such a disaster that everyone is now clamoring for criminalization to come back, because there's been so much more harm and overdose deaths, and that whether it's in Portugal or any other country that has adopted more progressive policies, that they're all regretting it because it's been such a disaster. So can you respond to this, please?
Shall I start and then I'll hand to you, Steve?
Sure.
Sure. I guess the first thing I will say, because I feel like this will come up a few times in the later things that we'll chat about, is that decrim and legal regulation are two separate things. When you hear somebody say decrim, what we think of as decrim is just the removal of criminalization. That's it. So there's no necessarily regulation implied. And so when we talk and even try to compare and contrast that around the world, that can take different forms in terms of things like thresholds and administrative sanctions and blah, blah, blah. There's a really good free e-learning course that's all about decrim if you're interested in going deep on this. That's by Input and IDPC. There's a link that will pop into the chat for that. That goes into the weeds of this. So I'll spare us all time, but even decrim itself is used differently to mean different things in different places. And then legal regulation is actually, there's a legalized market. You can go somewhere, you can access it, or there's various versions of that. And then there's actually standards to what can be sold in that legalized market. But those two things are very infrequently actually put into place at the same time. So you have decrim, and then you also have legalization and regulation.
So I think this is a helpful clarification, because in Singapore, when we talk about removing the death penalty or providing healthcare support for people who use drugs, rather than treating them as criminals, the government immediately leaps to oh, so you want to legalize drugs, you're narco liberals, there'll be drugs everywhere on every street corner, right? So the legal regulation, typically, I mean, you guys correct me if I'm wrong, legal regulation applies to the sale, right, of drugs, right. And decrim often refers to people who use and possess drugs.
Correct.
So I think that is the important distinction. When we talk about decriminalization, we're saying that people should not be treated as criminals for using drugs or possessing drugs. They should not have to go to jail or mandatory programs, or just subject to surveillance, policing, electronic tagging, whatever, everything that comes within the criminal framework if they use drugs or if they possess drugs. And legal regulation is a framework that is about the sale and supply of drugs. Right. So maybe Steve can say more about this.
Yes.
Yeah. Yeah, I mean the problem with one of the problems with these terms is that even for a term like decriminalization, which seems fairly clear, i.e., the removal of criminal sanctions for a particular offence, usually we're talking about possession of drugs for personal use, there can be an enormous variety of policy and practice around the world. Which drugs are included? Is it cannabis or is it all drugs? What are the thresholds? And I'm sure we'll come back to the thresholds issue later, that determine whether you're possession for personal use or possession with intent to supply. How is decriminalization administered? Is it at point of arrest? Is it post-arrest? Is it at court? Is it at court and prosecution point? And if there are no criminal sanctions, are there still other sanctions like fines, or in some countries you have suspension of passports or driving licenses? In some countries you have mandatory treatment referrals and so on. So there is an enormous array of policy and practice around decriminalization. And I would point people to an IDPC document, an advocacy guide on decriminalization, which digs into all of this, and it outlines what the best practice, the gold standard best practice in decriminalization would look like, which would be a no sanction model, which would expunge or delete all criminal records for now decriminalized offences. It would be designed with people who are impacted, including people who use drugs, at the center of the policy design process. And it also includes a shift of resources towards public health and services, because decriminalization has always been very much positioned as an enabler of a public health response. It's a good thing in its own right because it reduces the harms of criminalization, but significantly it's seen by its supporters, and I include in that the World Health Organization and the entire UN system. It's seen as an enabler of an effective public health response, because Shayla could, well, I'm sure we'll talk more about this, but one of the big problems with criminalizing people is that it creates obstacles to effective health interventions, and it doesn't reduce health harms, it amplifies them. So that is very much the rationale behind it. But yeah, again, there is a lot of different decrim in policy and practice. What we're calling for and advocating for is the gold standard, and that's outlined in the IDPC document that hopefully will appear in the chat.
It's already in the chat.
Oh, good.
Yeah. Okay.
Good.
So,
I'm not looking
can I ask you guys to go back to, I mean, now that you've done that clarification, go back to addressing that claim the government makes that it's been a disaster in places like Oregon or Portugal and other places that have moved towards like more liberal drug policies, that it's in fact caused like a crisis of overdose and violent crimes and all kinds of disasters.
I can start with Oregon. That's helpful from the US context. And then we probably could both talk about bits and bobs of Portugal. But effectively in Oregon, where you'll see headlines, like particularly from right-wing American media, that's like, this has been a disaster, this has failed, like Oregon recriminalizing now, that coverage was largely about homelessness in the state of Oregon. So already prior to decriminalization happening, there was a major housing crisis, particularly in the Portland area. And the context for this is that the neighboring cities around Portland, major cities in the United States, San Francisco, Seattle, these are major tech hubs that have already had major housing crises because of really rapid gentrification due to like the technology industry developing at the rate that it does. So Portland is the next on the map that is currently going through that process because Seattle's at capacity, San Francisco's been at capacity. And so there was already a series of bad policies in terms of housing people who are precariously housed in Portland. And then you have rapid new folks entering Portland seeking housing in what's actually geographically a pretty small city. So there's limited land to even build housing on there. And so you already had a lot of street homelessness and rough sleeping. And again, the United States is a context where we have a really poor welfare state. It's very difficult once you have lost your housing to like get back onto your feet. So Portland particularly exacerbated. This was already the case before decriminalization. When decriminalization happened, it very little time passed before these headlines started saying, well, it failed because look, there's all these people who are clearly street homeless because they're addicted to drugs, right? And there's loads of stereotypes and negative tropes about drug use being automatically linked to homelessness and vice versa. This was just the same audience of people that have been chronically rough sleeping for 3 or 5 years, as well as additional new rough sleepers. This is not about drugs at all. This is about poverty, and this is about housing policy. But those don't make spicy good headlines. Sensationalism about drugs and danger does. And that was the story that was told about Oregon. We didn't see increased rates of drug use.
It was very much drawn into the sort of part that very divisive politics that you see in the US, the sort of culture wars and left and right, and the right were using it as an opportunity to have a go at the Democrats, and it got dragged into politics, and any sort of sensible policy analysis, I think, was lost.
Yes,
and it was very unfortunate and widely misrepresented. And sorry, Shayla, I didn't mean to interrupt.
No, that's totally fine. But yeah, you're exactly right. And like everything around like drugs related coverage in the States right now is sort of dragged into that culture war bit. And so it's difficult to actually get like a materialist policy analysis of what's going on the ground. But yeah, it was a housing crisis issue. It wasn't a drugs issue.
Yeah, but I mean, you see, if you're trying to represent a policy position, you can basically say that anything good happens is you're responsible for, and anything bad that happens, you blame your opponents. And you just see this because bad things are happening everywhere, but people cherry pick a bit of data about fentanyl related deaths or homelessness, and then they go, look, that was decriminalization. And of course, all of those things were happening across all of the US. And they were happening in Oregon before the decriminalization. And in many ways, the decriminalization was designed to try and address those things by moving from a punitive model to a public health model. But it didn't even have the chance to get rolling before it had become a political football and it was all shut down. It was a tragedy, really. But, you know, there are plenty of other decriminalization jurisdictions around the world, like Portugal, and we can share a link to that in the chat as well, where the outcomes are much better. Not perfect, and people will try and misrepresent Portugal as well. But on the whole, decriminalization is generally regarded as a success, which is why the entire UN system has advocated for it, as do numerous medical authorities and authoritative voices across the globe.
So if you look past all this, like the politics of like culture wars and the media sensationalism and noise, what does the evidence show about decrim and the impact of decriminalization on things like, like social protections, better like welfare or like healthcare or crime rates? So these are things that Singaporeans are very concerned about.
Yeah. So on health, access to healthcare services is immediately improved with decrim. And I'll find a link after to stick in because we're slightly out of the order of the doc. Sorry to folks helping on the back end. But health-related outcomes improve with decriminalization. And this is because people feel safer to access health services and be potentially known as a drug user, right? Like there's less possible consequence. Also,
and there will be more resources for health services because we're not wasting all the money on criminalizing people. You can actually you have more funding for those health services by redirecting the resources into things that actually work.
So in our context, you could imagine if we didn't have to spend all the money we do on DRC and SANA, like I'm just saying it for the Singaporeans' benefit, right? Like Singapore Anti-Narcotics Association and all the like mandatory programs in the halfway houses, all of those resources that are used to surveil, like electronically monitor people, ask them to come back every week for urine testing in a way which like disrupts work and life. So all those resources could go into providing people access to healthcare, access to housing, access to financial assistance, and whatever else they need to actually live a decent life. Yeah,
absolutely. What I'll flag real quick, particularly thinking about the DRC, is there was a global, I'm pulling up my notes, there was a global report, I think this is from 2021, that, 2019 report of global opioid use found that only 2 interventions, health-related interventions, increased opiate use. And that was compulsory drug treatment and then directly criminalization. So also, if we're thinking about like trying to like target like root causes or things that help to drive various illicit drug use in our communities, right? Without putting a good or a bad on that. But like if the goal is reduction in drug use, mandatory forms of drug treatment actually increase drug use in your communities. And so like there's both like the cost and the amount of savings and the benefits to people's well-being, but also just like investing in these interventions just outright is ineffective.
And it's also I think it's worth saying it's just fundamentally unethical to identify in any kind of medical ethics or public health thinking. You don't identify a population of people, of a vulnerable population of people who are using drugs, who are specifically the ones who are having drug related problems, and then you criminalize their consenting adult risk behaviors. We don't do that with anything else. If people have alcohol problems, we don't put them in jail. We give them support to deal with their alcohol problems. If people have problems with tobacco or nicotine or misuse of pharmaceutical drugs, we give them treatment and support. We don't criminalize them. And the reason we don't do that is because it's not just wrong, but it doesn't work. There's no mystery here. We know how to deal with these problems. And punishing populations of vulnerable people by default is public health insanity, which is why all the public health authorities are very specifically opposed to that, or at least the ones outside of Singapore.
Okay,
and other craze.
You're both getting into your groove now.
Yeah, sorry.
It's like now you're in flow. Okay.
Probably answering questions further down already.
So with the ethical, I mean, of course, like I think, of course, like I agree, and like TJC agrees with the kind of ethical and moral way of looking at, or explanation of that, right? That we just can't punish people for adult consenting risk-taking behaviors, like you put it. But could you say a bit more, either of you, about like why it doesn't work, like why mandatory programs, detention, like kind of forcefully putting people in an institution and then like subjecting them to a certain like state intervention and program to like get them to abstain doesn't work, because a lot of people in Singapore have very deeply entrenched beliefs that is an effective deterrent, right? That people are then afraid of being detained in like DRC, and that when they go to these mandatory programs, then they're like off drugs, and it of course it should help them. Like why doesn't it work to fix people?
People don't work that way, right? Like if I was to go back to evidence, there's this Wakeman et al. 2020 study that I love to cite. It's not in the document, so I will find it later when Steve is talking and send it to folks. That looked at 40,000 adults diagnosed with like opioid use disorder. So these are all people problematically using opiate drugs specifically. And abstinence-based programming did not reduce anybody's likelihood of an overdose-related death. So this was just looking at the likelihood that folks will die as the most extreme sort of negative health outcome, which obviously has a cost into society, onto people's families, et cetera, et cetera. I'm not going to go into the morals of whether drug users should live or die here, but like just in terms of basic programming, abstinence-only programs were less likely to get folks to be abstinent than non-abstinence oriented like opiate substitution therapy programs, where people accessed in a consensual manner, specifically treatment of their choice, where people were treated with dignity and were able to access choice. They made the decisions that best improved their health. And those are the only times where we saw a decreased likelihood of drug-related death for those people. Any of the abstinence-oriented programs that didn't introduce choice as a key component, or even where there was choice, but there was no like therapeutic offering, there was just sort of like motivational key working, it wasn't enough to keep people from potentially dying. And I think that fundamentally, like when you try to force somebody into an abstinence-only framework, you make them more vulnerable to death, because what happens is the whole time that you're engaging in that mandatory treatment, let's say, your opiate tolerance or whatever tolerance for whatever drugs you've been consuming is falling. So your body is less and less used to it. But the moment you get outside and you're presented with the same stimuli that were previously triggering you to potentially use those drugs to cope with that stimuli, your tolerance is lower, but you'll probably use the same amount that you were using right before you engage with mandatory treatment. And then your likelihood of overdosing and dying is much higher. So we actually just put people in more vulnerable positions. These mandatory programs don't deal with the root causes of why people were using drugs in many of the circumstances they were using them. They're not holistic fixes. And then a lot of times the reason people are using these drugs in the first place, I mean, wide and varied, loads of people, loads of reasons, right? Everyone is an individual. But it's often because fundamentally we're all navigating a sick society. And so like we're finding ways to cope with trauma and poverty and precarity. And drugs have been a way that people across the world have dealt with that for time on time. And so if you don't address all of those reasons that like drugs were actually benefiting you in some way and coping with like really difficult circumstances, and instead you just say, just be abstinent and go back into those same difficult circumstances, one way or another, you're going to experience more vulnerability, whether that's returning to drug use and actually being more likely to die from that, or returning to other potentially negative coping mechanisms because you're still set with the same set of problems and one less tool.
And I totally agree with what Shayla. Just one very quick point is that decisions about treatment or other health interventions should be made between the individual person, the client or patient or person who's using drugs, and their service provider or doctor. That's where the decision should be made and informed with the best evidence. Not those decisions should not be made by politicians. Politicians are not doctors. They are not drug service providers. They are not in the position to make the right decisions. It has to be between the person who's using drugs and their practitioner. That's where the decision making needs to be, and it's guided by evidence of efficacy. As soon as these things become political decisions, you have non-medics making medical decisions, and that's where it all starts to go wrong.
Thank you. I would add to that, just to give a bit of like context in Singapore, that we see like very high rates of recidivism, though I don't like that term, right? But of people being trapped in the system again and again and again when it comes to drugs. And many of the people that we know and have gotten to know on death row and their families, actually like before they started selling drugs or possessing enough drugs to get them a conviction of drug trafficking, they spent years in and out of prison for drug consumption and possession, right? And so I think that in itself shows us that the DRC, which is like mandatory rehab or whatever, is really not effective. There's families that have tried to interview, like when an execution is upcoming, about their family member and like asking them like if they want to tell us, if they want the public to know their life story, and they say, well, he didn't have a life. I barely knew him because he spent the last 30 years in prison. The last time I have a memory of him was when he was 14. And for a lot of them, it's like they started going to prison at the age of 14 for drugs. And then they just kind of graduate through that like criminal punishment system till they end up on death row and then are executed at the age of like 40 something or 50 something, right? And that's the tragedy of our drug policy regime. And we've also done like many interviews with people who've been detained in DRC, and the government, it's really, really misleading that it's called the Drug Rehabilitation Center, because it's not only not mandatory treatment and mandatory rehab, it's not rehab and it's not treatment. Because anyone who's been to DRC, everyone we've interviewed will very openly and repeatedly insist it's just prison, right? And the government insists that they use like evidence-based programs of treatment. But when people who've been to DRC describe the programs there, a lot of them are just like, actually all of them are just about shame and stigma, and telling them day in and day out during the course sessions that you need to like care about your family enough to stop using, and these are all the harms of drugs, and that's why you shouldn't use them.
Kakila, it's self-evidently true, and the evidence completely backs this up, that if you have a criminal record or you have been in prison, it's much harder to find employment, to find housing, and your personal and community relationships suffer because of the stigma of your criminalization. And we also know that housing, employment, and community relationships are directly correlated to your ability to the likelihood of developing problematic drug use. So criminalization and incarceration, and particularly the trauma of incarceration, all make problematic drug use more likely, not less. Yeah. And as does abusive, forced treatment, abstinence-based treatment. So it's completely counterproductive. It's completely the reversal of everything we know about evidence-based interventions for people who have problems with their drug use.
Yeah, and before we move on to the next question, I just want to address one more aspect of criminalization, right? Is that it's not just that the person faces criminal penalties if they're caught by the police, but it has an impact on many areas that it filters down to through policy, like your access to welfare, your access to housing, your access to like ordinary healthcare, not just for your drug use, right? And one way that that shows up in Singapore is like mandatory reporting that healthcare workers have if someone comes in for any ailment and it needs any kind of treatment, and they're found to have like illegalized drugs in their system, they have to be reported to the narcotics police, right? And that actually deters a lot of people from seeking life-saving healthcare, and it
Right.
deters them from calling an ambulance when their friends overdose because they're afraid they're all going to go to prison and then
Right.
their friends die of an
And
overdose,
it has an intergenerational impact as well, because if you're one of your parents is criminalized or incarcerated, you yourself, the data suggests that those individuals are more likely to engage in problematic drug use. So again, it's not even just the person who's using the drugs is impacted by criminalization. It can ripple out across their families and across the wider community as well.
Right. Okay, I'm going to move on to the next question. Okay, so that, or the next prompt rather. So one of the things, again, that's a favorite argument for Minister Shanmugam is that countries that decriminalize or legally regulate drugs do so because they didn't take a harsh enough approach to begin with, and now they have no choice because it's everywhere and it's too late to go back. They have a crisis on their hands, and it's like it's such a big beast now that can't be reined in. But in Singapore, because we've had such strong and harsh laws from the beginning, we've managed to curtail the problem, and so we don't have to resort to harm reduction services or other forms of coping, which is actually something that he says all these countries do out of desperation, right, and no other choice. What's your response to that?
My initial response to it is it's complete garbage. I mean, it's just laughable nonsense. But just to dig into that, if you look across the world, there are a range of different regimes of varying harshness. Maybe Singapore is at one extreme, but there are other places in Europe, for example, or the US, which now have much more, you might call them liberal regimes, with decriminalization, legalization of cannabis, and so on. What you see if you compare them is that there is no clear correlation between the harshness of enforcement and the punitiveness of enforcement and levels of drug use or problematic drug use. There is no link. There are places with harsh policies that have low levels of use and high levels of use. There are places with liberal approaches that have high levels of use and others that have low levels of use. And if you track it through time as well, you don't see any obvious correlation with a change in policy and a change in use. So this idea that there is a clear link between punitiveness and levels of use is a complete myth, and there's plenty of evidence to support that position. It's easy to cherry pick an example that supports a particular position, but if you look at it overall, there is no clear pattern at all. And clearly there are other cultural, political, and economic forces that are driving patterns of drug use. It's not to do with the harshness of policy. Harshness of policy does not affect the levels of drug use, but it does affect the harms associated with that use. So harsher policies make drug use more dangerous, and harsher policies also have direct harms themselves that we've already touched upon. But again, the harshness of policy does not if it is any kind of impact, it is a marginal one compared to wider cultural, political, and social variables. And I'm sure Shayla wants to chip in on this.
Yeah, I was just gonna say, so if you wanted to cherry pick a counter example, China's had harsh drug policies, but also has the greatest number of injection drug users, right? Despite the very high number of executions as well. So like we could play the cherry picking game all day, but it just distracts from the context and the fact that there's
thousands. China, they don't publish data, but it is thought that they executing more than 1,000, perhaps multiple thousands of people for drug offenses every year. and they have more injecting drug users than any other country in the world. So this is just, it's a myth, you know, that Malaysia had the death penalty for smuggling for a long time, and they've mercifully, I think, suspended that now, haven't they? And, you know,
Yeah, they abolished the mandatory.
countries are evolving out of these ridiculous, barbaric, illegal policies. But Malaysia used to have a death penalty for smuggling of drugs, and they had I think the highest level of methamphetamine use of any country in the world. It's just a complete myth. It's absolute nonsense. Absolute nonsense.
Okay, I think we've driven the point home. Okay, so next one. Another favorite claim that we can see in a lot of like CNB, which is our Central Narcotics Bureau, like propaganda and all their like videos, which are really quite like a pain to the brain to watch. That one of their favorite like narrative arcs in all these like PSA videos is that using drugs is this terrible slippery slope. It's a death sentence, and immediately you take one puff, and that's it. You're screwed, right? Ruins your life, the lives of loved ones, the lives of family members, and also leads to you committing violent crimes and robbery. And so the only solution is full abstinence, right? Because it's so dangerous, and people who use drugs immediately victimize the people in their lives because they're using drugs. So what would you say to that?
I can start on this one, and I would link again to the fun dashboard from UNODC if you are a numbers person, because I am not naturally a numbers person. Go play with this. But the vast majority of drug use globally is non-problematic drug use. So that's the first bit before we even start to buckle down in the arguments about problematic drug use. So most recent figures globally, almost 1 in 13 people aged 15 to 64 worldwide use drugs in the past 12 months. And a bit more than 1 in 100 have a drug use disorder. So the vast majority of people who are currently using drugs do not have a problematic relationship to that drug use. Full stop. So the slippery slope thing is not the case. For people who do go on to develop a problematic relationship to substance, we still don't have evidence of, oh, these horrible things that are happening in community. Like violent crimes is just logically, think about it, is not a good way to fundraise if you're trying to routinely be able to make the money to buy the drugs that you are dependent on. Certainly, like, it doesn't make a lot of sense. And if drug use was such a slippery slope, we would expect to be in a mass global catastrophe based off the numbers I just told you many, many years ago. But it's not the case.
Yeah, and you know, this idea that abstinence is the only answer. There's nothing wrong with abstinence at all, and there's nothing wrong with abstinence-based treatment. But again, I come back to my point I made earlier, is that treatment decisions have to be made by the person who's using drugs and the person and their service provider or doctor. These should not be political decisions. Now, abstinence-based treatment may be appropriate for some people, but it has to be consenting and voluntary. But other people may not be ready to stop, or may not. Abstinence-based treatment hasn't worked for them in the past, and it's just not for everybody. So it's part of the toolbox, but it's not the entire toolbox. You know, there are lots of different treatment approaches. Abstinence-based treatment is one of them, and it can be very useful and appropriate. But the idea that you only have that one, or that you know, you force people to have that one, it's profoundly unethical from any reasonable medical perspective. And it's also unscientific, because if you force people into the wrong treatment regime, the outcomes will always be bad and suboptimal.
You know, one of my favorite metaphors to use in trying to explain this is relationships, right? Like romantic relationships. You can be in a really healthy one, or you could be in a toxic or abusive one. But even if somebody was in an abusive relationship, you wouldn't find it ethical to drag them away from their partner and enforce no contact, as opposed to just allowing the person to make choices and supporting them in the choices they want to make, right? I think there is an assumption also in Singapore that automatically if someone uses drugs, then they have a problematic use, a problematic relationship with the drugs, and that their life is dysfunctional. right? And there is really not at all an imagination or acknowledgement that there's many, many people who use in a way that actually elevates their life or does not contribute to any harm in their life or the people who care about them.
Right.
Um,
And
or
people
who use it in like recreational and casual ways where it's where they don't have even a, it's like hookups, right? Like it doesn't have a long-term impact on their lives. I really think it's quite a great metaphor. I don't know what you think.
Yeah, but I mean, alcohol is an instructive example. Everybody knows the difference between having a glass of wine with your dinner at the weekend, or having a couple of beers with your friends after work or something. And loads of people in Singapore drink, including politicians, who you might want to suggest are being a little bit hypocritical here, because alcohol is a drug. It's much more dangerous than many of those illegal ones that you're executing people for. And people understand the difference between responsible recreational alcohol use and drinking a bottle of rum with your breakfast every morning. There's clearly a difference there. But whatever your pattern of alcohol use is, the idea that you would be criminalized or imprisoned or executed for that would be seen as absurd and ridiculous. But it's a drug like all the other drugs. It's addictive, it's dangerous, you can overdose and die. We manage it, we regulate it. We may not do it very well with certain drugs, but nonetheless, no one's suggesting that we should criminalize and execute people for alcohol. That would be ridiculous. And it's just as ridiculous for other drugs.
But it used to be, right, that there was alcohol prohibition. Do either one,
There was.
I mean, want to talk about the failure of that and why regimes
Sure. I
moved
mean, some
away?
countries have banned alcohol in the past, and some still do in the Middle East, for example. But alcohol prohibition in the US, most famously perhaps the Al Capone era in the 1920s and 30s, it was a total disaster. Alcohol use went up for the entire period of alcohol prohibition, and it didn't get rid of alcohol use. It empowered organized crime and mafia to sell it instead. So it made alcohol more dangerous. And it fueled lots of crime and suffering. And eventually, 12 years, 13 years later, it was repealed because it had been such a disaster.
And
But
health harm also,
drug prohibition is no different.
Yeah,
Sorry, go on.
health harm, similar to drug prohibition, actually. Alcohol consumption moved into various types of facilities, right? And people attempting to homebrew and acquire unregulated supplies of alcohol that were much more harmful to people's health. So not only did you have people's use increasing and did you have like this money diverted in this way into these organized crime groups, but also just people were ingesting now substances that were much more toxic and they had much less control on the ability to like dose their alcohol accordingly or know if their alcohol was even like human bodily safe alcohol in the first place.
Right. Yeah, they all moved to spirits instead of wine and beer, and spirits were more dangerous, but they're easier to transport. So, and you see this with so many different drug markets where the more potent and dangerous versions of drugs start to prevail in illegal markets because they're easier to transport. And they're more profitable. So the prohibition and illegal markets tilt the market towards the most dangerous forms of drugs. So it's easy to get crack in the UK, for example, on the streets, but you can't get coca leaf and which is essentially the same drug, but very different preparations associated with very different risks. But you can only get the most dangerous one in the illegal market because it's so much more profitable.
So could you guys say a little bit more about how like harsh penalties and prohibition and illegalization actually makes puts people who use drugs at more risk, right? And makes supply of drugs a lot more unsafe. I think you've kind of gestured at like, I mean, you've said that it does, but why does it do that? Why does it make drugs more unsafe?
Sure. So firstly, just almost like anything, I don't know if this is the case in Singapore for food supplements, but we've had this issue over and over in the US with food supplements. Like when a market's not regulated, right, there's not minimum quality standards or anyone doing quality assurance. So there's nobody on any of the illicit substances. There's nobody doing quality assurance. So you can buy something and let's take the UK, for instance, because different countries have various different ways of dealing with this. So in some countries, even where there's no regulation, you can still test your drugs through various public funded facilities. The UK largely doesn't have this other than I'll ignore the asterisk for now. But let's pretend you're just a person in a small town in England and you buy your drugs on the dark web or from your guy down the street, and it's not a regulated market and you're hoping for the best. And maybe you've even gone with this guy before and things have been good. You don't, each and every time is a total roll of the dice. There could be something different in there. It could be what you're expecting, right? Like maybe you're trying to buy drug like oxycodone, but now it's double the strength, but it looks identical because the concentration of drug to like filler ingredients of that pill could be different. And you'd have no way of telling until you took it and like experienced a negative health outcome or died, because the dosing was double and there's no way to distinguish that as a user. So everything from the quantity, the purity variations, right? Like if it's even what you thought you were being sold at all, you don't know any of that when you're accessing an illicit market. Then on top of that, obviously, there's all the criminalization components that like, if I'm using a drug that's criminalized and I live in public housing, like I could very easily be kicked out or any housing, right? Like it'd be grounds for my landlords, for me as a renter, to be removed from my home. So I'm going to try and use as much as possible in secret, even if I'm not worried about the criminal penalties, but because of the housing consequences and all of the above, right? Like, and the stigma from my family and the everything else. So now you're using a drug of unknown quantity, of unknown purity, right? Could have toxic other cuts or adulterants in it that could cause me bodily harm. And I'm going to use them by myself somewhere where nobody can see me or access me if I become unconscious or unwell, because I'm so afraid of all of the consequences. And so then let's say I do go over because my dose is double or because there's an adulterant and I'm by myself, and maybe I happen to survive that experience. The fact that I was unconscious with low oxygen for 20 minutes because I was having a form of overdose that caused me to have low respiratory activity means that I could have permanent brain damage now, right? And so on and so forth. Like all of these things just stack on top of each other. With illicit
And of
drug.
course, and there's no information on the packaging either. You know, when you buy a
Yes.
pack of cigarettes, I think I don't know what the rules are in Singapore, but it says smoking causes cancer. You should quit. Smoking is bad for you. Quite often there's a picture of like a cancerous lung or some horrible throat cancer or something, and we have in these when you buy cigarettes in the UK, or when you buy drugs in a chemist from your pharmacist, they can give you advice. They say, well, maybe you shouldn't take this if you're taking this, or don't mix this with this, or are you pregnant, or whatever, blah blah blah. You don't have any of those opportunities on a legal market to give people information either on the packaging or at point of sale. So again, illegal supply and criminalization makes risky drugs more risky, and it doesn't stop people using them, doesn't stop or stop the market. So, you know, this is on any measure, it makes the health problems associated with drugs worse, not better.
Right. And, you know, I think this is maybe a good point at which to bring up that the government has recently, again, under the auspices of Minister Shanmugam, introduced Drug Victims Remembrance Day, where they parade out families of people whose lives have been lost to drug overdose and other drug-related health problems, and using that as a way to justify why we need harsh drug policies and the continuation of the death penalty, right? And it makes me so angry because I keep thinking so many of these people may not have died of drug overdoses if they had had access to healthcare, if they had had access to safe supply, right? And that he's using those very victims to justify and reinforce the murderous policies that caused a lot of these people to be in such positions of desperation to begin with, right? So I think that, you know, that's something that I hope that, you know, more people also like reflect on.
Yeah, I mean, June 26th is the UN's World Anti-Drugs Day, the World Day Against Drugs. And actually, it's been reclaimed by the drug policy reform movements around the world as Support Don't Punish Day. Like we shouldn't be celebrating a prohibitionist, punitive system that has failed and delivered such terrible outcomes. We need to be celebrating effective public health interventions and advocating for those. So, you know, there's now in 200 cities around the world on June 26th, on World Anti-Drugs Day, you get Support Don't Punish actions, that we shouldn't be punishing people for drugs and we shouldn't be celebrating punitive policies. We should be providing the public health support and services that people who use drugs need to stay safe or get treatment or harm reduction that actually helps them, because we know very clearly that punishing, criminalizing, imprisoning these people makes everything worse, and it's incredibly expensive.
Okay. Ooh, I just lost my notes. Okay, found them. Okay, next question. Okay. So the minister also says that pushes for for liberalization, right, broadly, whether it's decrim or legal regulation, is growing because of corporate interests and big business. And drug policy reform activists are paving the path for, or even colluding with big business, are being funded by big business who have interest in like legal drug markets. So what would you say to this?
I mean, I can start briefly with that I think there is some truth in that. I don't think it's complete. I mean, as with a lot of the things that the ministers or your politicians say, there's often a grain of truth in there, wrapped in a lot of untruth or nonsense or obscured. They ignore other arguments or other points. So there is some truth in that, and we've certainly seen the dangers of commercialization of drug markets with things like alcohol and tobacco companies advertising and marketing essentially unhealthy activities to vulnerable populations like youth. So you see sport teams sponsored by alcohol companies, and Formula One racing sponsored by tobacco companies, and so on. Historically, it is a problem, but that is why, as we move forward into legally regulated markets for other drugs like cannabis, we need to learn the lessons from that and not repeat them. So we need to advocate for responsible regulation where those commercial incentives and profit-making incentives and over-commercialization and corporatization and corporate monopolies aren't allowed to prosper. And actually, you have this amazing opportunity to do that, because you can establish a new market architecture where those problems are prevented. You can have state monopolies or non-profit corporations or non-profit cooperatives. You don't have to have something that looks exactly like alcohol and tobacco.
Well, I think there's two things I want to add to that, right? Like, one is that I think that argument the minister makes also ignores that there are already huge businesses profiting hugely from the sale of drugs. It's like a multi-trillion-dollar industry, right? They just don't pay taxes. They're not regulated. They don't have to like provide workers any rights. They don't have to make sure that their products are safe. So it's just like a like illegal business that operate with so much impunity. And secondly, also, it is drug policy reform activists who are at the forefront of making sure that drug policy reforms don't fall prey to corporate capture, right? And aren't the ones like colluding with these corporate interests in like legalized markets. Anything else you guys want to say on that, or?
I was just going to offer a brief anecdote on this around the sort of, because if I was a listener, I would be like, why would I believe that drug policy activists wouldn't take a big pay cut from corporate interests? And there's a nice link in here that we can share around the sort of journey to like legalizing cannabis in New York. And Cassandra Frederic, who's in charge of the Drug Policy Alliance in the US, tells this story about there was an opportunity to legalize cannabis years earlier in the state of New York in the United States. And it was one in which part of the lobbying effort was by, more corporate interests. But in it was going to leave behind most of New York State. So it was focused on New York City. There's various bits that were wrong in the sort of like journey to decrim and legalization. But it didn't have any focus on social equity. So the vast majority of people who were being punished for cannabis across the state of New York, but especially in the city, were Black and Latino people. And there was no components that were actually going to protect in any way that any profits being made from this new market being legalized were going to in any way invest back into communities that were in part deeply impoverished because of the lack of employment access for generations due to the racialized policing of this particular drug. And so actually drug policy activists like Cassandra got in the way of this earlier legalization being passed. So drug policy activists, there's a history actually of saying, if it's not the social equity model, like we will combat the corporate interests that try to proceed with the markets that put profits over people. And so I think there is a differentiation to be made.
But I think, you know, if
guys, we need to move on. Okay.
Oh, very quickly. Yeah. If there is bad practice in legal markets and regulation, I think it's good to be critical of it. I mean, we shouldn't just accept it. As Shayla said, you don't just accept something because it's legalization. There's good and bad forms of regulation, and we need to advocate for the good forms and be critical of the bad ones. You know, Thailand sort of legalized cannabis and has made a bit of a mess of it, and we shouldn't just accept that. We should say, no, you need to do better.
Okay. So I'm going to skip to the sixth prompt on our shared document, okay? Because we don't have a lot of time left, so I just want to focus on some of the key arguments we haven't tackled yet. So I'm going to share a quote from Minister Shanmugam from his ministerial statement in Parliament, I think. He says, "You remove the death penalty, drug trafficking will go up significantly. There'll be more robberies, house breakings, and so on, because drug abusers will need money to buy drugs. There will also be, evidence shows, more sexual assaults, more homicides, and definitely many more people will die in Singapore." Okay, go. Have at it.
I mean, I think the first thing to say is that, you know, I think for most people, the arguments for and against the death penalty are fairly well rehearsed. So I'm not just going to plow straight into that. But specifically on the death penalty for drug supply and deterrence, there is no evidence. There is no evidence that the death penalty stops the market from operating or significantly deters people. And even if it deters some individuals from participating in drug-related supply offences, there are thousands of other vulnerable people who need the money or can be persuaded or tricked or duped or whatever it is into participating in drug-related supply. So, you know, you arrest or execute one person or deter one person, there are thousands of other people who are in the queue behind them. And there is no evidence from anywhere in the world that when you start executing people, that there is some amazing impact on drug supply, availability, or contraction of drug markets. So that evidence simply does not exist. And we've already referred to some of that, like the experience in China and Malaysia and some other death penalty states. That there is no evidence. It's absolute mythology. So we just have to get past this idea that somehow the death penalty, it's just, I mean, we've heard Donald Trump talking it up in this election campaign. Absolute rubbish. He says, look, we could bring back the death penalty in the US and we would end the fentanyl crisis. It's like, no, you wouldn't. They've already got the death penalty in the US. You know, it's just, there's no factual basis for this at all. And I think we need to be really, really clear about that.
Shayla?
Yeah, I would only just echo that, and I think this link will go into the chat. Everything Steve said, and that when you look at places like Portugal, when they decriminalized, a lot of the crimes that are being worried about in this quote actually decreased. So I'd be curious when we say evidence shows more sexual assaults, more homicides, what evidence? Because the evidence I've seen shows the opposite.
Right. You know, one of the things that the minister also likes to do is that if there is ever a case of, like, you know, someone assaulting a family member or someone on the street, and they happen to have some amount of drugs in their system, immediately build the narrative of causation and that they did this because of the drugs that they were taking. When, again, we all know how unscientific, how convoluted that is. You know, and I often think, well, you know, what if this person was capable of doing more harm if they weren't taking substances that helped them regulate their emotions and met their needs, right? Like,
I mean, or just like, what if every time somebody committed an atrocious crime, I analyzed their body to see if they had recently drank Sprite, and I was like, Sprite is causing murders, sexual assaults. Like, we could do this for so many things because we know, like, globally,
yeah, it's like sometimes I get in a fight with my partner after I smoke a cigarette, sometimes without. I don't know, maybe we should see whether there's a correlation to the smoking.
Right. But I mean, and the drug that is most obviously connected to actual violence is alcohol, which is legal, and it's the one that all the Singapore politicians like to drink at their swanky parties on the top floor of the Raffles Hotel or wherever it is.
Right. Okay.
Little Singapore reference there.
Okay, so I'm just gonna have us take up a few more minutes before I go to questions, and then maybe if we don't have plenty of questions, we can return to some of the other myths or arguments we wanted to tackle, right? Okay, so what else haven't we addressed? Okay, so another like very common kind of like headline in Singapore, when there's like drug raids and many people are caught, or even when a few people are caught with like certain amounts of drugs, it'll be like, oh, this person or this group was seized, like this amount of drugs was seized on this in this like CNB operation, and that can feed the addiction of X number of abusers for a week. Can you tell everyone what is bad and wrong about this message?
I
I
mean,
mean, all of it.
everything is bad and wrong about it. There is no correlation between seizures and drug availability. I mean, occasionally you will get a seizure that is so big that there will be a brief contraction in availability. But what that does is it attracts other illegal actors into the market to take advantage of this gap in the market. So the market is it's profit motivated. The illegal market is profit motivated. It's incredibly flexible, incredibly responsive. It's controlled by a bunch of criminal entrepreneurs who are all about the money. And if they see an opportunity, they will take it, and they take it every single time. But even then, the amount of drugs that are seized as a percentage of the total market, it's usually in single digits. So for the organized crime groups, it's like paying a bit of VAT. It's like a tax, and these drugs are these markets are so profitable that they don't care. You know, if they lose 1 in 10 of every shipment, they don't care. So every time you see politicians waving around these seizures, going, "Look, we've stopped these drugs landing on the street," they're talking rubbish, because it has no effect, zero effect on availability, price, or use of drugs, or
And therefore,
incredibly rarely, and
right,
even then it's temporary.
and therefore safety, right? In the sense of like, if you associate availability of drugs with unsafety, because that's the message they keep trying to send, is like, oh, we took so much of this off the market that would now otherwise be causing so many people to overdose and so many people to get addicted. And it's always framed as like it would feed
Yes.
these many abusers for a week, right? Yeah.
What I would say,
they're not abusing. It's nonsense. Sorry, go on, Shay.
is that, so let's say, for instance, you take a certain drug away. So what we've seen globally recently, right, is that there's been lots of worries about heroin disappearing because the Taliban banned opium production in Afghanistan as of like April 2022. So there's been loads of rustlings about heroin disappearing. What we've seen now is that a much more dangerous, potent substance, nitazines, these group of synthetic opiates in the UK context, are coming in because they're easier to smuggle in smaller packages because they're so much more potent, right? So often what happens is, if you did successfully disappear a drug, usually something more potent comes in its place and creates a bigger public health crisis for folks afterwards. And so even again, assuming that seizures did ever put a dent in anything, all you're doing is creating a vacuum where probably something more potent and harmful is going to come
right.
in.
If you're a drug organized crime group or a drug smuggler, and you're like, shall I bring a kilo of heroin into Singapore, or shall I bring like a matchbox full of fentanyl? You'd bring the fentanyl, because you can sell it for the same money, but it's much easier to transport. So, and this is again, we've talked about this. It incentivizes the market to move towards these more potent, dangerous drugs. So again,
Right.
the war on drugs is doing the opposite of what it's supposed to do. It's not keeping people safe, it's putting them in danger.
And it also like incentivizes like when the stakes are higher for people to get into trouble with the law and to get very heavy sentences, then it also incentivizes businesses in this market and individual people to like transport it in smaller and smaller packages, right, that are less detectable. And then that also makes then the packages, each like dose or package, more potent, because you still want to deliver that that high, and you want people to get dependent, right? And the more dependent they are, then of course the more demand there is, right, for substances. So yeah, I think we've covered a lot of this. That I think, and so I just want to touch on one last point that is linked to this whole claim of, like, this amount of substance will feed these many abusers for a week, is the presumptions in our laws around trafficking. And so this has been recently hotly debated after a post that TJC put up that the minister took issue with. But we have thresholds in the law that then trigger a presumption of the accused person trafficking, right? As opposed to like it being for consumption, for personal use and consumption. And so I want to ask for your views on thresholds being used as a way to determine how much someone can reasonably use, and as a way to presume that they in fact have the drugs for the purpose of sale to others, which then is what triggers the trafficking charge. And also then there are thresholds that trigger the death penalty, again on presumption of trafficking, once you hit that certain threshold. So there's a threshold that says you're trafficking, and then a slightly higher threshold that then triggers the death penalty for trafficking, right? And it is on the accused person to rebut the presumption of trafficking by proving, and they can use different kinds of defenses, but the most common one that they rely upon is a defense of personal consumption, right? That they had a significant amount of those drugs for personal consumption, and regularly the courts will reject those arguments by saying that, oh, it's not like, it doesn't actually make sense for someone to keep that much for their own consumption. So what are the issues with this narrative and this approach to determining if someone is trafficking, or how much someone can consume or not consume?
Loads. Firstly, there's not a scientific way to figure out what somebody can consume and not consume. People's bodies differ in loads of different ways in terms of your metabolism, in terms of various genetic predispositions to how you metabolize different substances, how long you've used that substance, what size you are, etc. Right? So I know, I've got the threshold in front of me, 15 grams of diamorphine. That's a totally reasonable amount somebody could buy for themselves to use over a period of time. Because that's one of the other factors.
I just want to clarify, that's the threshold for the death penalty in Singapore, is if someone's caught with 15 grams of diamorphine, which is heroin. Yeah.
Yes. That's a totally reasonable amount for somebody to buy for themselves. So already in the first place, but even let's pretend the thresholds are double or triple that, right? There will always be a point where these things vary so much. Where you exist somewhere with really harsh penalties for buying drugs, it makes sense to buy your drugs in bulk so that the transaction is less frequent, so that you're less likely than if you're buying in tiny amounts on a daily basis, right? So there's already a logical reason to buy in bulk. You often get a better deal when you buy in bulk if you have the means to do that. Loads and loads of reasons that it makes sense to do that. So already how you differentiate that doesn't work. Also, like I've said, lots and lots of people use drugs. Not everybody is dependent. And lots of drug users look really different. If you don't look the way you're expected to look as a person who's using heroin, right? I would imagine that trying to make the defense that it was your heroin for you to use would probably be more likely to fail. So I imagine there's also a really loaded trope about what a drug user who is dependent is meant to look and sound like, or someone who's using frequently. Because not all people who use drugs frequently are drug dependent either. There's loads of mess there just in terms of the actual drug bits. I know Steve also had a bit on thresholds that I figured.
Yeah, I mean, in any kind of fixed threshold with an automatic trigger of an offence or automatic trigger of the death. I mean, obviously we shouldn't have the death penalty at all. But whenever you have a fixed threshold with an automatic assumption of guilt beyond it, it's intrinsically arbitrary. It's bad lawmaking, because you've alluded to this, Kokila, that you're reversing the burden of proof. The burden of proof should be on the accuser to show that someone has intent to supply, rather than for the individual to prove that they're not. That this basic legal principles around rule of law is that you shouldn't reverse the burden of proof, and that is implicit in these arbitrary thresholds. It's quite a tricky and messy area, and I think there's a briefing that Transform's done that we'll put in the chat that digs into some of these things. But yeah, I mean, you there does need to be a way to make a distinction between possession and intent to supply offences. Even in a legal regime, you still arguably need that. You know, people might have 1 million cigarettes in their house and then, you know, a cash till. It might be suggesting that they're illegally selling cigarettes. You may need some way to make that distinction, but it shouldn't be arbitrary thresholds. It shouldn't be automatically triggering. And you need to be able to take in contextual factors, mitigation and aggravating circumstances. Like, you know, if someone has a pile of money and a load of individual bags, they're probably selling drugs. Fine. If someone has just a larger quantity of drugs, it may be, as Shayla says, because they have other reasons for buying in bulk or whatever it is.
Okay, so, thank you. Okay.
Right.
Okay.
I want to talk more.
Yeah, you can in response to questions. I know we had planned some things we wanted to touch on as a way of concluding, but I was thinking we could do that at the end of the webinar. So let's take some questions and then go on to our conclusion. So I'm looking at the questions that have been already put into the written Q&A box. People also, please feel free at this point to like raise your hand if you want to ask a live question, and then I'll call on you and you'll be unmuted and able to ask directly so that it's a bit more interactive. But for now, I'm going to start with some of the questions until I see raised hands. We'll tackle some of the questions that are in the Q&A box. Okay, so the first one is that it says, I'm convinced that the harshness of our legal system is not truly rehabilitative, but I fear with the lack of laws about people experimenting with drugs leading to terrible outcomes. Another related example, I'm glad there are no guns readily available in Singapore. If they had been, a lot of things could and will go wrong. One of you wants to take this? I also have some thoughts, but I'll let one of you go first.
I mean, I suppose the thing with drug prohibitions is that they don't, I mean, I think we've touched on this, that they don't stop people taking drugs and they don't stop drugs being available. Now, it's very difficult with Singapore to have any kind of sense about what's going on in the drug market, because if the government is collecting any decent data on this, which is questionable, they're certainly not publishing it. And you can imagine if you're a member of the public and a government official comes along and does a drug survey and says, are you taking any of these drugs? You're obviously going to say no, because if you said yes, they'll probably, arrest you and imprison and execute you or something. So we don't really have much of a sense of what the problems are in Singapore anyway. But the assumption is the fact that you keep having to keep executing people, and that clearly there are drugs in Singapore. I mean, there's no mystery about that. We just don't know how many. But it's the idea that Singapore is drug free is clearly ridiculous, despite all of this death penalty stuff. So we don't even know anyway.
So I think some things I would add to that is that, for one, there is no data available on the drug market, the rate of use and consumption, or extent of people using types of drugs that are available or popular on the market. All we have is anecdotal information. But what people who are often in conflict with the law around drugs and who are keep going in that system, and the communities that they come from, what they keep saying is can you open your eyes and look around you? There's drugs everywhere in Singapore. We can access them in our neighborhoods. You can get them on Telegram. And for a lot of young children growing up in communities of where there's poverty, and also in international schools. And again, we know anecdotally that in international schools and a lot of wealthier estates, there are drug parties and people are using drugs quite liberally. And what we see is two ends of this spectrum. Which is often what we hear a lot of the anecdotal stories from, is that there is a lot of drugs available, and even for kind of people in the middle, in terms of socioeconomic status, that there is access to recreational drugs, there is access to drugs in different ways, and people are making their own choices and assessments of what they want to use, when they want to use, what they feel they have no choice but to use if they've grown up in certain environments. And I think what is also like, so I think first of all we need to question that there aren't drugs available in Singapore, or that they're not already posing a danger to people when there is no like proper information, advice you can access, people you can talk to openly. Like if I wanted to, I don't know, like start pole dancing, I could talk to people who have done it quite openly to ask like, what are the risks of falling? Or like, what do you think I should do to take precautions, or like make sure that I don't get, injured while pole dancing. But you can't do that with drugs because of this like punitive environment, right? So a lot of, I guess, what people worry about is terrible outcomes can also be addressed if there was more information, if it was safer for people to ask questions, to like if there was labeling, some of the things we've already discussed, that would then allow people to make informed choices about what they're using, how much they're using, right? Yeah, I don't know I have more thoughts, but do you guys want to add anything else to this?
I would just add on the gun comparison, somebody from the gun land, like they're sort of like inverses of each other. So like drugs, like you're in the gun situation now, like there are drugs everywhere. And based off also people I know that have lived and here in Kokila speak, like the drugs are there, but nobody can get information on how to use them. And then the actual danger to everyone is like, obviously like there's a moral danger in terms of like us watching peers being sentenced to death in the global scale. But in terms of just like health dangers, things like bloodborne virus transmission, right? Like impact to our like health system, like people's health outcomes we know are worse in criminalized environments. And then like everyone bears the burden, not just people who use drugs. And so like you're in the dangerous environment now. Whereas like guns, once guns are there, then people are shooting each other, pew pew, like then that's the dangerous environment. Like the drugs are omnipresent, and it's just whether or not the access to information and strategies for safety will be there or not.
Yeah, it's just like how a lot of people, still don't believe that there is poverty in Singapore. Even though there is a lot of poverty, it's just very sophisticatedly invisibilized. And so it's the same with drug use, right? And a lot of the people suffering without any help for their problems related to drug use. So I think just to complete the example of like the people that again anecdotally know of the cultures of like drug parties in wealthier circles and like in international schools, what happens when someone develops any kind of problematic drug use is they get shipped off to like expensive drug rehab in other countries, because there is no zero like voluntary rehab in Singapore, right? And no independent like treatment or facilities or healthcare that doesn't require reporting to the police. So they all just like get on these flights and go somewhere else and get the support that they need.
It's the same with harm reduction.
But poor people go to prison, right? Yeah. So yeah,
it's the same with harm reduction. I think if you have a sort of dogmatic ideological position like the Singaporean government, which is incredibly focused on zero tolerance and abstinence-based treatment only, and very much a sort of war on drugs narrative, there's very little space left for harm reduction, which is where which deals with the reality of drug use as it exists, and drug use is a reality in Singapore as it is everywhere. But it seeks to manage and accept the reality of that drug use and manage it to reduce the harm that it causes, both for the individuals who are using drugs and for the wider community. It's impossible to do that, or it's very, very hard to do that in places like Singapore that are unwilling to acknowledge anything other than abstinence and abstinence-based treatment, and this target of a drug-free society. But yet harm reduction, again, if you look at the literature from the United Nations, it's fundamental part of the right to health. It's advocated by the World Health Organization, by UNAIDS, by the UN Office on Drugs and Crime. And the UN Office on Drugs and Crime is a prohibitionist entity, and it still advocates for harm reduction as a paradigm and as a set of interventions. So, even these basic rights in terms of the right to health and the right to treatment and services are not being met in Singapore because of their blinkered ideological backward viewpoint on drugs and drug policy and drug laws.
Okay, I'm going to request that you guys try, especially Steve, try and keep your answers a bit shorter, okay? Because
What
like,
are you saying?
if you can summarize, then do, because so we can get through more questions. Okay, thank you. Okay, so the another question is, because a lot of the questions are not questions, they're comments, so I'm trying to filter through them. A question is like, my sense of the Singapore government's line is that we don't need to talk about all these things, but whether criminalization leads to more dangerous supply, or like, what can we do to help people, blah, 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 because it would be just much better to stop everyone from using drugs in the first place, which is what they call harm prevention, right? It's supposed to harm reduction. And so I think a lot of Singaporeans also still buy into this, and there's a very strong just say no sort of sentiment in Singapore. Like, we don't have to deal with any of these problems, and like providing harm reduction services, whatever else we're talking about. Like, how do we regulate supply? How do we make people safe? If people just said no, right? So how do we tackle this? And can we talk about how problematic it is to fixate on stopping everyone from taking drugs over everything else? Shayla, maybe?
Yeah, I think we've covered a lot that we know it's not realistic for lots of reasons, right? But I would also say, like, from a policymaking perspective, you don't make policies based off your ideal hypotheticals. Like, right? Like, wouldn't it be great if everyone just drove at a sensible driving speed? We will abolish like all like driving related regulations tomorrow, because actually the goal is just that each individual self-regulates their driving safely. So we don't have to legally tell you to wear seatbelts or that this is the speed limit in this area. You can kind of look at things also based off of like the likelihood and then like the risk related to that. So like sort of like probability and then like the consequences if that thing happens. And so even if you say the likelihood that an individual in Singapore is going to use certain drugs is low, the consequence in the Singaporean context where there's not harm reduction is really high in terms of individual and community level health impact. And so even if we don't want people using drugs, we put the provisions in place that are like, if somebody is using drugs, these are the things that people can access. And so there's lots of societies globally that are still quite anti-drug, that have more liberal drug policies saying, if somebody's using drugs, these are the health interventions that we have. But you'll still find at a community level, there's loads of stigma against drug use. Like those two things don't go hand in hand necessarily. You would expect less stigma in places with more liberal policies. There's lots of stigma in places that also have drug consumption rooms. So like you put the things in place because the consequence of not having them is things like HIV and hepatitis C outbreaks and like mass death events in the case of a particularly potent drug supply. And so you do them anyhow.
No, I mean, I think it's worth saying there's nothing wrong with prevention per se. I think it's perfectly legitimate for the government to encourage people to make healthy decisions. And even if they want to encourage people to be abstinent, I think that's all. I don't have an essential problem with that, but we have to deal with reality. And I think this is the point that you both of you have made. The reality is that prevention messages, even when they're done well, which they not generally aren't, but even when they are done well, abstinence-based messages, they don't work for everybody, and we can't just ignore the minority, albeit a significant minority of people who prevention messages don't work for. You still have to deal with them because we are policymakers and we have to deal with reality. And so you have to have harm reduction and treatment services and information services as well. And you have to be able to balance harm reduction messages with abstinence and prevention messages more broadly. And it's about preventing harm rather than preventing just use, because we have to deal with reality.
Right.
So I think that yeah.
And so maybe this is a good opportunity for us to talk a bit about the reasons people use drugs, right? And how those reasons don't disappear when you tell people to stop using drugs and just say no. So could you speak a bit to that? Maybe to build on things you've already shared or elaborate.
Yeah. And this might be a good resource for here that I've not linked, but it can. There's critiques of this as well. I could be annoying about this all day. I'll try to keep it short. But like Gabor Mate talks a lot about trauma and people's ability to like respond to trauma in part through their drug use. People self-medicate in a variety of means. People can be self-medicating for like mental harms that they're experiencing. People can be self-medicating because of physical harm. We know like instances of undiagnosed chronic pain, for instance, in communities that are poor and in racialized communities are really high. And that often also because of racism and classism in our medical institutions, those are often not taken seriously. And so people from more precarious backgrounds and more oppressed backgrounds are more likely to have reasons to self-medicate for the physical impacts, the pain alleviating impacts of drugs. Because it's also a natural response to systems of oppression to try and find ways outside of state institutions to like deal with those problems in a day-to-day way. There's loads of logical, rational reasons. People also use drugs to enhance pleasurable experiences. People use them to go out with their friends and experience a night out in a funner way. People use them to enhance experiences of intimacy. People use them to help boost their self-esteem, right? Like there's an entire spectrum of things from increasing pleasure to self-medicating both physical and mental health issues. All legitimate reasons to use drugs.
And again, I think the comparison with alcohol there, you know, people like alcohol, drink alcohol because they like it, you know, and some people drink alcohol to forget it. Some with all drugs, that some is to feel good, and sometimes it's to stop feeling bad. And like Shayla says, there's this range of motivations, but it applies to alcohol as well. And I think that's a good reference point for people. And it's been a characteristic of societies but for millennia across the world. It's almost a universal human instinct to seek altered states in some shape or form, whether it's for pleasure, whether it's for personal self-exploration, whether it's to stop feeling pain or whatever it is. It's always been there, and it probably in some form always will. And responsible policymakers have to deal with that reality. That is your starting point. You can't just wish it away.
Right. And I guess it's also maybe useful to talk about like those reasons being different, like when people like the reasons why people might start using, as opposed to like also when people then develop dependence, and there's a whole other host of reasons why they continue to use and actually cannot not use, and it's dangerous to them to be for the substance to be taken away or not be available anymore because of the extent of like withdrawal and pain and suffering that they would experience if they didn't have it anymore. Right.
Sure, but people are making responsible choices. People are making informed choices.
Rational choices.
Rational choices. I mean, not always, but often people are making rational choices. They weigh up the costs and benefits for themselves, and the costs include risks of the drugs, include risks of the law and enforcement, and the benefits, whatever they may be, whether it's pleasure or relief of pain or whatever. And they make those decisions. And across the world, people do decide, despite decades, generations of fighting a war on drugs and threats of everything up to in execution, people still choose to use drugs. So again, that has to be your starting point as a policymaker, not the world that you wish for or you imagine, the world that we live in. And in that world, lots of people are taking drugs, whether you like it or not.
Yeah. Okay, I'm going to pick another question. Unless anybody wants to ask a question live, I don't see any hands up. I don't know whether that's a problem with what I can see. Are there hands up that I'm not able to see?
I don't think so.
Okay, so I'll keep going with the questions in the chat. Okay, so someone has asked, what about NAMS, which is our National Addiction Management Service, and programs like NA, Narcotics Anonymous, is the only place users can supposedly go to for treatment and support without getting criminalized, i.e. arrested for drug use. So I think I might have to take this one. Okay, so yes, it's true that NAMS, so NAMS is the like state kind of provided service, which is under our Institute of Mental Health, which is like a public mental health hospital. And they have an addiction management service that people can seek both inpatient and outpatient services in. And it's the only place that you can go to while you have drugs in your system and not like get arrested immediately by CNB right after that. But if my understanding is accurate, and I think it is, NAM still has to report to CNB. It's just that it doesn't trigger arrest the way that it would if you went to any other hospital or place. And there are many limitations. I think some people have found NAMS has some relative like helpfulness, right? But there are limited beds in NAMS, and there's also, I think, only either a 2-week program, or I think they might have increased it to 1 month now of inpatient program. But I've heard again, like I have friends and people I care about who are terrified of going to NAMS because they have a drug record already, and they have, you know, been arrested and sent to DRC or prison before, and they're just terrified of any institution that could report them to CNB, regardless of whether there is some kind of like quiet assurance. It's not even an explicit or consistent assurance that you won't be arrested. Also because from our understanding, CNB doesn't want people to use the NAMS as a way to avoid arrest. Like you go there when you're like using it as a way to avoid arrest. So they don't even make it an explicit enough reassurance that people won't get arrested. Yeah, so people still have a lot of fear around going to NAMS when they're using, because then their name is on the record again. And so that means that even if they don't get arrested immediately, their CNB is alerted to the fact that they have been using, and so could start surveilling or policing them. And yeah, and Narcotics Anonymous is definitely like a community support, like peer support space that some people have found helpful. Again, I think it has some limits because it is abstinence only, right? And people are, yeah, again, like people I know who have like not been able to stop using feel like there is shame and stigma when they go, and that they, yeah, that there's no like kind of harm reduction possibilities to discuss in these spaces for them too. So that's what I know, and I think Shayla wants to say something.
Yeah, so I was just going to say, so my understanding from NAMS is that the offer is like a short-term inpatient offer. So with all the caveats like you've made about criminalization risks still being there, both of these, so the study that I've just posted, I was referencing earlier, this is the study on like more than 40,000 people using opiates problematically in the States. That shows that it's neither of these are actually effective interventions on their own for like preventing the likelihood of a drug-related death. So like effectively, like if we were to use that as a metric of success for them, they would fail. So like they're not evidence-backed. That's not to deny that some people will find them helpful in their individual relationships to those drugs that they're trying to change, right? But for all the reasons Koki said, and just if we were to look at the science behind them, they're not broad scale generally considered effective.
Yeah, so my understanding is also that what NAMS provides is more like detox, right? And then, so just to kind of, in the immediate sense, keep people a bit more comfortable and safer if they're in withdrawal or whatever, and that there's some kind of basic amount of like counseling of it, but it is not, again, something that people can rely on as an ongoing form of support to address their relationship with drugs in ways that is self-determined and that they seek.
Yeah, I think, I mean, you have there's certainly a place for detox and rehab beds. There's certainly a place for Narcotics Anonymous type services, but they have to be part of a range of different, I've talked about the toolbox before. There are a range of different tools in the toolbox. Those may work for some people, but certainly not everybody. And you need to, if you're only restricted to those ones because of the political thing, again, you've got politicians making medical decisions. There are other treatment modalities that need to be available as well, and the decisions need to be made by doctors, not by politicians.
Right. Yeah. And I think it cannot be stated enough how then climate of such great fear, stigma, and criminalization makes it very difficult for people to pluck up the courage, and it should not require courage to get care, right? To access what little services there are available, right? Yeah, so Okay, so another question is, again, I think no hands are up. Okay, so another question in the chat is, what countries would you say are getting it right with drug policy, and how?
That's a tricky one. I think that I don't think there's any one country that's got it right with everything. I think you can look at examples of good practice in different areas of drug policy and find and highlight those. So I mean, Portugal, for example, has very much been held up as an example of good practice in decriminalization of personal use. I'm actually a bit dubious about that now. I mean, they actually made their reform 23 years ago now, and it hasn't evolved since then as much as it could. I think there are other good examples of decriminalization that are probably more evolved than that. And if you look at something like legalization, it's completely different. So, nowhere had legalized cannabis 11, 12 years ago. Today, we're looking at tens of different jurisdictions, maybe 45, 30 or 40 jurisdictions have now implemented some form of legal adult cannabis access. And there's now 500 million people or more living in legal cannabis jurisdictions. So, I mean, if anything, it shows that change can happen. This sort of consensus around prohibition and the war on drugs has decisively broken, and cannabis is the most obvious example of that. But within that, there is, and we've already touched on this, there is good and bad practice. Uruguay has almost like a state monopoly, a very restricted legal regime. Thailand and some has a very unregulated commercial model that's almost completely unregulated. You barely call it a model. Some US cannabis states are very commercialized, more like alcohol and tobacco. Canada is perhaps somewhere in between the US and the more restrictive, the more commercial US models and the more restrictive models. We need to be looking at all of those examples and learning the lessons of what's working and what's not working, and be honest about the not working bit. And then we can draw on those lessons and some of that best practice to inform policy debates in individual jurisdictions. But clearly, any individual jurisdiction, that their policy needs to be shaped by the individual culture, political landscape, the needs, the nature of drug use and drug related problems and drug market related problems in their countries. You can't impose what best practice looks like on anywhere. They have to determine that for themselves. But there's lots of good practice to draw on and lots of bad practice, and we need to be looking at both, obviously, to avoid the latter and embrace the former.
Okay. I know it kind of feels a bit like going back to the basics, but I think it's a good way to like kind of leave people with a bit more clarity as we are moving towards closing. Could I ask Shayla for you to share a little bit about what you think are some of the most useful and transformative interventions when it comes to harm reduction, right? And then for Steve, if you could shed a bit of light on like what different possibilities or like on the spectrum of legal regulation things could look like, especially like your recommendations, right, that you've put together for different bodies, like like how different drugs can be regulated. Like just, I think like in closing, I think it'd be helpful for people if we could paint a concrete picture, because I think we've talked a lot in terms of like principles and philosophically about a lot of these things, but it'd be great to, as we move to close, like have some concrete examples of what some of this could look like. So if you could paint a picture. Shayla? Sure.
I'm trying to not do principles but concrete, but I'm going to stick up principles resources in the chat. Sorry, everybody. But in the meanwhile, I guess for me, like the purpose and like harm reduction stuff that's meaningful is effectively environments where people can go that we would call low threshold. So you don't need to give a name, you don't need to give any identifying information. And this is regardless of if you're in an environment with criminalization or not, right? Like ideally, no criminalization. But even still, people might want to be private because of stigma and other things. And you can go and you can get a range of healthcare services that day, regardless of insurance, regardless of your immigration status, right? Regardless of any like criminal legal system status. And that might look like being able to take drugs that you've acquired illicitly and then test them and check their contents and their purity so you can get advice on how to use them, to take away the materials, be it pipes, for smoking or needles for injecting or other materials for snorting or for other means of consuming drugs. Take resources like that away. Be offered extra resources. Do you have friends who are scared to come here because they're afraid to be in touch with services? That's okay. Take extra, take them stuff too. Is there other things that we can give you at the same time? Do you want to talk about your housing or your food access, right? Like a one-stop shop that does all of that. Even better, that has doctors on site that can address your physical and mental health needs, but also can say, would you be interested in a prescribed, safer alternative to what you're acquiring illicitly? These are the medications we can offer instead. And then you can actually just check in with us about taking those in a way that works for you, that then diverts you away from spending money that maybe you're struggling to acquire in the first place on the illicit market, because you're now going through the sort of prescription access scheme instead, and you're able to access these other things where we know the content and purity from the get-go. That's what harm reduction ideally can look like for folks.
Right. Yeah, and I would say that there are like also community-based ways we can start to imagine and think about harm reduction in Singapore in a broader sense, right? Like even under such punitive laws and such like heavy criminalization and fear for people who use drugs, I think it is harm reduction, like as a person who's a friend or cares about someone who uses drugs, to be the one person that doesn't like shame them or push them into secrecy, right? Who listen or who will like ask what they need and like provide support and care in ways that that person wants. It can be harm reduction to like, you know, like not get someone in legal trouble, right? And then, I mean, I think there's just like, it's even if some of the things that Shayla is talking about might seem quite far away for us in Singapore, I think it is still like possible for us to apply those principles, which is basically that if people are using, how do we like care for their safety and health and well-being, regardless of what decisions they're making around their use, and in that way give them more options to use or not use in ways that or change their use in ways that work for them, right? Yeah. Shayla, did you want to say more?
Oh, I can let Steve go because I know we're close to time, but I thought that I had to be concrete. So, but yes, absolutely would affirm that all of those things are harm reduction.
Yeah. And the reason, I mean, just maybe because I think people don't have the context here, like Shayla was talking about providing like pipes or needle and syringe programs and things like that. And the reason for that is so that people can use in ways that are safer for them, if that wasn't clear, right? And that ways that prevent overdose, or ways that prevent infections from like people sharing syringes or using in more unsafe ways because they don't have access to certain like resources like clean pipes, etc. Yeah. Okay, Steve, go.
I put a little note explaining a bit about regulation and the different models of regulation in the chat. I mean, I very briefly, I haven't got time to go into this, but you know, we already regulate lots of drugs. We regulate alcohol and tobacco, not always particularly well. I think we've made some progress with tobacco, and you can look, tobacco use has been going down for the last 20 or 30, 40 years through better regulation and public health education, at the same time that illegal drug use has been going up. So maybe there's a lesson there. You know, we didn't have to ban tobacco. We didn't have to criminalize anyone for tobacco. We don't have to execute anyone for smuggling tobacco. We can regulate even dangerous drugs like tobacco can be more or less responsibly regulated. So we need to learn those lessons. And different drugs will be regulated in different ways. There's not one model. You know, the more risky a drug is, the more justifiable I think state intervention in that market is. And you know, I can talk. If I had time, I would talk about the basic principles about social justice and equity, about public health that guide all the thinking on that. But if you're interested, please just go and look at the website, the Transform website, and some of the other links that we've shared. I think obviously different places are in different positions on their drug law reform journey. I mean, it feels like for Singapore, the immediate challenge is to end some of these particularly egregious, abusive policies like the death penalty, and to ensure basic access to basic harm reduction and support services. You know, obviously those things perhaps need to happen first. I think part of that is a discussion around ending the criminalization of people who use drugs, and we've talked about that quite a lot today. And I think once those basic things have been addressed, then we can begin an adult discussion on regulation. And it will probably begin with cannabis, inevitably, perhaps, and as it has elsewhere in the world. And then we can move on to other drugs and other medical models and all kinds of different discussions around that. It's quite complicated and messy. But I think if there was one message that I wanted to sort of finish with, because I appreciate we're coming to the end here, it's that all of these debates, whether it's the harm reduction stuff that began in the 80s and 90s, whether it's the decriminalization debates that have followed on afterwards, they have been incredibly successful around the world. And, harm reduction is now standard practice in over 100 countries. Decriminalization is happening in over 50 different jurisdictions. Regulation is happening of cannabis is happening on every continent. In all of those cases, we are winning the arguments because we are right. The war on drugs has clearly failed. Prohibition is a failed policy paradigm. The discussion is moving to what follows. What do we do instead? And all of those changes, all of that reform has always been led from the bottom. It's a bottom-up process. It's been led by local authorities, local activists, local NGOs, smaller jurisdictions. It's always been a bottom-up process. The leadership has never come really from national governments, or very rarely, and certainly hasn't come from the UN again until recently. And even where the UN is now showing leadership, it got to that point because of a bottom-up process led by civil society. So we, civil society, we are the change makers. This is where the change begins. We are the ones taking the risks. We are the ones doing the work, establishing the modalities that deliver the goals that we all share, including even in the Singapore government. We all want the same thing. Ultimately, it's just we've got a pathway that will actually lead us there. The governments have pathways that are taking us in the opposite direction. But it's always been civil society led, and that's where that is the pathway. That's the future. We have to show the leadership here because our governments absolutely are failing to do so.
Thanks, Steve. Shayla, do you want to say anything to that, like how progressive drug policy reform has taken shape in other contexts, right? That used to have a strong stance on prohibition or harsh drug laws in the past, as what we see in Singapore now. Because I think often in Singapore, people find it very difficult to imagine that we can ever move away from the war on drugs because it's so such a big part of this government's like political and like coercive logics, right? Like it is such a big part of their narrative of who they are as a government, and it's such a dominant like part of the Singapore imaginary that we're drug free and we say no to drugs and we have zero tolerance. And so I think people find it very difficult to imagine progressive drug policy reform ever being possible here. Are there examples or things you guys can point to as to, in contexts similar to Singapore, that were similar to Singapore in the past, that were like, we'll never move away from prohibition? How has progressive drug policy reform taken shape?
Yeah, I mean, I guess I would talk about, and maybe you'd say, no, this isn't a fair comparison point, which is, I don't know. But like my immediate thoughts are about the US. And as a person sort of growing up in the US, like obviously now you look at the US and you don't think of it as this sort of like prohibition place, but obviously like the war on drugs was its project, right? Like all around the globe. And at home, like growing up, I grew up in Baltimore, which is a very drug heavily policed area. Like everyone knew someone, everyone had an immediate family member in a prison for a drug related offense. Like it's a different apparatus and the consequences are different. But even I'm wedding planning right now with my partner, and I was like, we have to go back to the States because none of my family can travel, because none of them are allowed to have a passport, because they've all been incarcerated with felony level charges related to drugs. And so like we cannot do something in the country where we live. So like that was the environment we all grew up in, while also trying to do all of the harm reduction and the drug policy reform things. And I think a lot about I'll talk about in New York City, where they have an overdose prevention site now. So a facility where people can consume their drugs and people can look out for them. That wasn't built through like benevolent new politicians just deciding that their mind changed overnight about drug policy reform. That was built because there was so much anger and outrage and a developed political consciousness and understanding amongst people living in New York City, predominantly working class people who had seen the devastation, who had been to prison themselves, who had lost relatives, who said, like, we will back in our numbers, in our masses, the opening of this overdose prevention site. And an attorney general come to shut it down, be damned. Like, it became an act, it would be political suicide to come try and shut that down in the current context, because you would have the masses fully against you. It was a grassroots community building effort. And I think that that's like the learning in the environment where I see lots of like, that's how it moves. And then of course, like the media narrative becomes something different, that, oh, it's just not intense on prohibition anymore. But it's like, no, it was people power first. And of course, that is not what the documented history of that will be when we look back in 10 years' time. But that to me feels like it moves through like building and sharing that outrage and grief and turning that into action at the local level.
Thank you. I think that is a very inspiring note to end on. So I think like what I'm hoping people like do feel able to take away is that change is possible, even in Singapore, and it will be led by the people and by all of us being in solidarity with each other, in solidarity with people who are incarcerated for drugs, who are on death row, by caring about our communities, right? And the well-being and health and safety, especially of the most vulnerable people in our communities. And people who use drugs are amongst the most vulnerable people. And it's through our care and our fierce protection of each other and solidarity with each other that we can fight back against oppressive systems that are intent on killing and caging the people we care about, and the people who really deserve justice and well-being and safety and health, right? So just maybe I know we're a little bit over time, so I just want to share some concrete things that TJC is working on. Like, so one of the things our drug policy working group is focusing on at the moment is mapping the drug control regime in Singapore and its harms, because it is a very like mystified regime. You know, it's so convoluted with so many different like pathways that people can take, from like electronic tagging to like weekly urine testing and different kinds of incarceration and halfway houses and work release programs. So we're trying to first map it and understand the experiences of people who are trapped in different parts of the system, and how it harms so many things for them, like possibilities of work and community integration through the punitive and surveilling approach it takes. The second thing we're focused on is working towards ending mandatory reporting by healthcare workers, so that people can at least access healthcare when they have drugs in their system, regardless of, and that doesn't even require like full decrim or anything, or even decriminalization. Just requires that healthcare providers are allowed to actually treat their patients and not criminalize them. And I think like it would be also really, I don't think we should see it as beyond our imagination at this point to push for pilot harm reduction programs. And we would have to, imagine what that could look like in our context. And I say this because that's a lot of how drug policy reform in Malaysia happened. Like, even while prohibition remained in place and very punitive criminalization of people who use drugs remained in place, they just started piloting in small, like in one neighborhood or in one small area, like harm reduction programs. And I think that we can learn from those things and see what's possible here too. So those are some of the things that we're working on, dreaming up and trying to make possible. So if you'd like to get involved, you can join TJC. And I just want to say thank you very much to Steve and Shayla. It's been very fun to talk. And I think people learned a lot. I really hope they did. And yeah, we will be back with other events. This weekend we have 2 film screenings of a film that tells the story of a prisoner on death row who was then exonerated. And at the end of next week, we'll have more events. So just look at our website and sign up for other World Day events. Thank you. And lots of love to Steve and Shayla. And
Thank you.
lots of solidarity.
And solidarity to y'all. Thank you so much,
Thank you,
DJC, for
everybody.
having us, and have a good one, y'all.
Solidarity,
Thank
stay
you.
strong. Thank you.
Bye, y'all.
Bye. Oh,
Ray, we can get naked.
no, there's still people in the room.